15 new cases since my update yesterday. 8 of those 15 are linked to known outbreaks and complex cases. 7 are under investigation by our public health team. 2 cases were reclassified. There have now been 807 deaths due to this global pandemic. I'm sad to report that is an increase of 1 since yesterday, and we send our sympathies and condolences to that family. There are 21 Victorians in hospital. 1 is in intensive care, and I'm pleased to say that no Victorians are on a ventilator. A total of 2,763,802 test results have been received since the beginning of the year, which is an increase of 9,286 test results since yesterday. If you look at those both yesterday and the day before, so essentially the weekend's numbers, to be above 9,000, that's a good strong number, certainly better than we have achieved in recent weekends. And I take this opportunity again just to thank those almost 9,300 Victorians who went and got tested over the weekend, predominantly Sunday and Monday. Can I thank them very much for the part that they are playing and have played in giving us the most complete picture of where this virus is, how it's being transmitted, and how basically underpinning us putting a public health response around each of those positive cases, supporting them, their family and every family by preventing this virus spreading further, certainly preventing it from spreading as far as it would spread if they had not got tested, had very mild symptoms or no symptoms at all in some circumstances. This moves so rapidly that getting tested when you first register those symptoms is critically important. So again, can I ask every single Victorian, regardless of where you are, regardless of your circumstances, even the mildest of symptoms, please come forward and get tested. Don't delay but for a day or two. Please go and get tested as soon as you register those symptoms. Apart from following the rules, which of course is something we all have to do, there's arguably nothing more important than symptomatic Victorians coming forward and getting a test. That underpins this entire strategy. There are 27 healthcare workers who are active cases. We send them our best wishes, like all active cases, but we of course thank them and their colleagues for their amazing efforts. The rolling average to 5 October is 10.6 cases in Metro, 0.3 in regional Victoria. Mystery cases for the 14-day period to 3 October is 13 in metropolitan Melbourne and none in regional Victoria. The Metro regional split is a little bit complicated today, and I'll let Brett speak to this in relation to the Chadstone outbreak and the fact that it's run to Mitchell Shire and indeed up into the northeast as well. There is 1 additional case in third step regional Victorian local government areas. There are 3 active cases in regional Victoria. Brett will speak to this in more detail in just a moment, but if I can thank everybody in and around that Kilmore community, whether it be the cafe, the owner, the staff, and the broader Kilmore community. I'm advised that we've got a drive-through clinic there testing today. There's some other pop-up activity that's happening. I understand the drive-through is basically booked out for the day, so that is just a fantastic effort, and we're very, very grateful to everybody in that community for coming forward and playing their part in trying to track or test, then track and trace anyone in that community that might be positive as a result of that outbreak. In terms of active cases in aged care, there are 66 active cases in aged care, so those numbers continue to fall, which is very pleasing. In terms of the total number of aged care shifts that have been worked by hospital staff, 4,832, and as I've noted on multiple occasions, very few, if any, of those staff would ever have thought that they would be working in private sector aged care, but they've stepped up and they're doing an amazing job, and we're very grateful to them. There remains just 1 active case in disability facility settings. That is a staff member, and that is essentially the numbers of the day that I needed to go to. I'll just make a couple of general comments. The fact that we've got now going on for 30 cases out of outer southeast or Bayside, so Frankston, Chadstone, Kilmore up into the northeast in such a short period of time, it speaks volumes to the infectivity of this thing. The fact that your symptoms can be so mild as to not even register, or register but not necessarily prompt you to go and get a test.